So my presentation today was focused on 4 key themes. The first one was on chronic lymphocytic leukemia. We are now ready with 2 drugs which are ready for prime time. The first one was, of course, a long-term follow-up of the Ibrutinib data based on the RESONATE trial. It continues to show efficacy. No new safety signals were identified, so it remains a standard of care for frontline CLL patients. CLL14 trial, which actually for the first time looked at fixed duration targeted therapy with venetoclax and obinutuzumab. And with this data, we were able to see not only efficacy, but also patients who were able to stop therapy after 12 months. MRD data was very compelling. Of course, longer-term follow-up is needed. At present, FDA has also approved venetoclax plus obinutuzumab for patients with frontline CLL. So in the armamentarium of our treatment strategies, we now have venetoclax and obinutuzumab also approved for patients with CLL. In patients with marginal zone lymphoma, I highlighted an abstract that really tested a new PI3K delta inhibitor called umbralisib in relapsed refractory marginal zone lymphomas. So relapsed refractory marginal zone lymphomas, as investigators as well as physicians know, doesn't really have a lot of thriving options that are durable. So it was interesting to see that umbralisib did have efficacy at the median follow-up of almost a year and a half. The median PFS has not been reached. In terms of AEs or adverse events, we didn't really see any colitis with this drug. On the other hand, other adverse events were very manageable. The third topic that I covered was follicular lymphoma. So recently, based on the AUGMENT trial in patients with relapsed follicular lymphoma, rituximab plus lenalidomide got FDA approval. And this abstract basically highlighted what really happens to patients who fail either, which is either rituximab or rituximab and lenalidomide. And this abstract really showed that time to next lymphoma treatment as well as response to other therapies was much better in patients who received Revlimid and rituximab or lenalidomide and rituximab. And then the fourth key theme was really around diffuse large cell lymphoma. And really at this point in time with diffuse large cell lymphoma, there are multiple CAR-T abstracts that were presented at ASCO which continued to show durability. I highlighted some of those and then I took the audience through some of the other key abstracts, especially in relapsed mantle cell lymphoma and relapsed CLL, to highlight the benefit of CAR-T cell therapy.